Good morning. Thank you for joining CCN. This is Consumers Doctor, Dr. Bengala. Focus on consumer. Americans, all Americans, if you're listening, I've been, I've been, I've been going berserk, coming after all the Americans. You have a choice to make, man. You all Americans, families, individuals, small businesses, large businesses, government sector, Medicare, ARP, CMS, HHS, and all the Congress, Senate, and the presidency. If you are listening to this, Americans want freedom. They want freedom from the shackles of healthcare. They want to pay co-pays, deductibles, denials, rejections, and you can't see this doctor, you cannot go to this hospital, you cannot. Come on, that's not going to work. That will never work for Americans. They want freedom. Americans, wake up, wake up. This is what we want, freedom in healthcare. How do we get it? I'll give you a simple thing, folks. No matter which sector you are in, you're self-employed, working for anybody, you're working for a small, large, and you're Medicare, you're in even unemployed, you belong to an impaired medical group. Especially my focus is on 20% of the poor population. This is for you, man. This is for you. This is what I want to see. I want the government to give them 100,000 insurance, life insurance, 100,000. 20% of the Americans are poor, 15 to 20%. Who deserves, they need to get a free life insurance and also health coverage with a certificate of guaranteed coverage with incentives attached to it. So even for the lower income folks, they need to create incentives so they can save money and put money aside, which is attached to their social security and ID card. They should have a power. They should have the power to choose. Especially, I'm talking about the lower income group. They should have the power to choose. Give them 5-10 choices to all the plans, state subsidized, federal subsidized. Give them the choice. Let them lower their premium and have them get health solutions advantage accounts. It has to be mandated. I would like to see mandated. This is what the ACA government mandated. This is where the government can take advantage. They mandate everybody to have health solutions advantage accounts, and it needs to be protected. This is where the government comes in. Consumers, no matter which sector, I'm talking about everybody, which sector you're on, most of them have insurance, traditional health insurance. That's not for you. You really need to rethink, change it. You know why? Because your premiums are based on risk, broad category, pooling risk. That's not allowable, folks. This is what they're doing. When your premiums are based on broad risk pool sharing, those are not the right quotes. They need to be segmented. Risk segmentation. This is taught by Ron Bachman. This is such a beauty. Risk segmentation. They should not pool the risk across the broad spectrum. 63% of the Americans are healthy. They are well. They belong to the well category. Their premiums should be a lot lower. They don't need to share the risks from the other categories. Their premium should be lower. They should be able to put money aside into the health solutions advantage. I want all the 63% of the Americans well category to participate in health disclosure, healthy pricing. Just disclose your health. Once you're given the health insurance, you're guaranteed for life. Nobody can take it away. This is an asset, folks. Why can't we consider it as an asset? You're investing in yourself, even for a family. Health is an asset. take it like a home insurance, a car insurance. Have it along with your ID card. Health Solutions Advantage accounts tied to the card so you can pay as you go. So that's number one. Number two, the well category people, they deserve it. And tomorrow I would like to see insurance companies advertising for, oh, this is the premium for this is 60% of the category. This is our premium. I want a competition in that category. Next category, the risk segmentation is a beauty. Risk segmentation is the next category is chronic illnesses. There are only 16% of the Americans have chronic illness. Their claims are 41%. That's where we are losing. That's where we're losing. And government is wasting with the stupid CPT, DRG codes. Medicare is wasting our money. It doesn't matter. Even they're all wasting. What I would like to see, let consumers decide. If you belong to a chronic illness category, government will give you certificate of guaranteed coverage. No questions asked. But you have to have health disclosure, healthy pricing. We need to know where your financial standings are. Basing on that, health disclosure, healthy premiums will be adjusted, and I want them to advertise for people with chronic illnesses. They need to know what the premiums are. They need to advertise it, and it needs to be transparent. Okay? And the third category, this is the risk segment. Third category is at risk. People are at risk. Drug addicts, smokers, obesity. Even people with, we can probably put even hypertension, I guess. They need to be, their premiums are based and at risk. Or people who are pilots, flying, you're prone for, whatever the at risk, your premiums have to be based on what you are at risk. Not broadcast what you are at risk, your premiums have. I want to see premium advertised for at-risk group. This is where your premiums can be. They can be a part of the health disclosure, healthy pricing, lower the premium. You can still put money aside, folks. Don't take me wrong. You can still put money aside, that $300 or $750 for a family of four, into the Health Solutions Advantage. It's called health savings. And the last but not the least is so-called, what is it? At risk, catastrophic. That is it. Catastrophic coverage. Catastrophic coverage, nobody knows. Life is unpredictable. Tomorrow you're crossing the street, you can have an accident. You can have an accident. What I'm saying is catastrophic coverage. That needs to be for all. You have to have a catastrophic coverage. So every segment has to include the catastrophic coverage. So your premiums can be, if you are at risk, or if you are prone for these things, if you're a druggie, I'm telling you, if you're a drug addict, you'll never know. It's a catastrophic coverage. You really need to, if you're a drug addict and you're driving a vehicle, you have to have a catastrophic. You cannot get out of the way. That's where the technology comes in, folks. This automation. I'm hoping that people die from accidental injuries. So many. The automation is going to change that. Hopefully, I think technology is on our side, folks. Technology, take advantage of it. Telehealth, telemedicine, hubs. There are hubs going to be popping up everywhere. We need to deregulate the healthcare. This is what amazes me, is when you can Go to the food industry, they are so competitive. Why is it they're hesitant to deregulate the healthcare? Why are they choking these doctors, providers, hospitals, insurance? They're choking with regulation. Insurance companies, hospitals are being choked to death with the regulations. We need to deregulate, man. You know, what Ronald Reagan to this country is amazing, and the airlines. You've never seen it. I want something similar in health. Deregulate the healthcare. Where, don't take me wrong, I want them to, government to oversight, like any other food industry, over government oversight for public safety. I am 100% for that, but you don't need to choke them till the level that the only other choice for them is to raise the price. That's what is the cost of the healthcare is going rising. Consumers, Americans, if you are listening, get health disclosure, healthy pricing accounts, man, right away, and participate in the health solutions advantage. HTHP with HSA. If you like this channel, hit the subscription button. I am your consumer's doctor. Hit the notification button. This is Dr. Bengala. I would like to see in my lifetime free consumers in healthcare, choosing the healthcare, what they need. I want Americans to be free from shackles of healthcare. Again, thank you very much for listening to my conversation. See you next time.